I think I can just, since I thought about that. You said I could hit the exit so you can move the toolbar. All right, well, it's not really singing in the way, is it?
What's that? No.
Oh, the toolbar, okay. Anyway, it's a pleasure to have Dr. Botts here. He's been a few years since he's been out here, but he's spoken to my class several times, if not probably 10 times, I would guess. He's probably been coming out for a decade, but
Yeah.
during COVID and the last couple of years, we haven't connected, but I'm really glad to have him out here. So anyway, thanks, Dr. Botts, for coming out and visiting us.
Sure, I'm happy to be here. And I'll share that actually just a couple of weeks ago, I had a student in my office from this course that now is applying to optometry school. I was so glad that I was able to help her. She did some shadowing, so she came in, she watched for a week what we do, and she's applying to be an optometrist. And so here's what I'm excited about: is somebody in this room is going to be an optometrist. I'm convinced of it now. I mean, number one, it's such a good profession. It's got the perfect, what do they call it, work-life balance, along with the ability to provide immediate satisfaction to your patients. I really think that optometry has, it's been a perfect profession for me for sure. And because of that, you don't see emergency patients every day. You pretty much get to work your schedule that you set. Most of the patients that come in to you on a day in, day out basis are not super sick, and you can help them today. I mean, you can prescribe glasses. I can give you contact lenses. I can make you see today, and you know, that is just extremely fulfilling for me as a professional to be able to make a difference for patients today. So what we're going to talk about today is a little bit about the profession, a little bit about what do you got to do to get into optometry school, because it is a hurdle. You know, you got to be a good student. You really got to want it. It's 8 years of your life, 4 years of undergraduate, 4 years of optometry school. So it's a long haul to get there. I will tell you, the day you graduate from any professional school, you'll say, "Oh, that was worth it." But where you're sitting right now, it's a whole different picture, because it's a long. Actually, for most of you, it's more than a third of your life. For me, it's like a microsecond of my life, but that's because I'm an old person. So.
Anything else? This one will work really well for that.
Okay. Ah.
Sorry about the hassle. Looks like I have to use this open.
That's right. I can use that.
Okay.
Okay, so here's a definition of an optometrist. So basically what we do is we treat eyes only. And in the state of Illinois, we can treat ocular disease, we can prescribe glasses, we can prescribe contact lenses. In about 12 other states, they have passed laws in those states that actually allow us to do surgery. So optometry now in a handful of states are actually doing surgical laser procedures, removing lumps and bumps off the lid. And so our scope of practice is constantly growing. It starts with one state to pass a law, and then the other 50 states will pass laws in the next few years. Optometry is a legislated profession. And what does that mean? That means that the reason we can practice optometry is because there's a law on the books in the state of Illinois that says optometry is a profession, and if you meet the criteria to become an optometrist, you're licensed, then you can perform optometry in the state of Illinois. Okay, that is like almost every other profession except if you are a medical doctor. A medical doctor typically is a doctor and can practice medicine because they have a license of medicine it's not because there's a law that states they can. Okay, but just about every other, if you want to be a chiropractor, a dentist, just about every other healthcare professional typically requires a law in the books to be able to practice, which in all 50 states, there are laws that allow us to practice optometry. So what do? Like I said, we treat eye disease, we diagnose it, we treat it. We prescribe glasses, we prescribe contacts, and also, like I said, do additional surgical procedures and laser procedures in certain states. What's changed over my profession over the last, I've been practicing now for 31 years. It's been a fast 31 years, but the technology is constantly being updated in how we take care of patients, from the practice management software we use. I mean, when I started, everything was on paper. Today, it's all obviously on a computer. There's very little paper that we utilize today in a practice. That has evolved significantly. The instrumentation that we use, constantly updating, always getting new, better ways of doing things. In fact, this year I just added a new treatment for dry eye. It's called low level light therapy. It's actually using a light lamp that puts light on your eyelids to treat dry eye. To me, it's super cool, the way that we can treat something as significant as dry eye with something as simple as a lamp. But the technology is there to allow us to get the exact right color wavelength of light in order to do exactly what we want it to do. And different colors will do different things. Red light will do inflammation. Blue light will actually take out bacteria. So if you have bacteria on the surface of your eyes, we can actually now treat it. Obviously, we've always been able to treat it with antibiotics and drops, but now we can actually treat it with a blue low light therapy treatment as well. So technology always changing. Products, the type of contact lenses we fit today versus what we fit 30 years ago it's just a lifetime difference between them. The technology is so much better. They're so much more comfortable. They're just so much better. So everything's improving with everything we do. Here's examples of technology. This is actually an older version of OCT that has actually evolved into a much smaller instrument. It shows, this is actually a picture of a retinal detachment. So if anybody's ever heard of a retinal detachment or seen or have a family member or friend who's had a retinal detachment, it's actually a detachment of the retina in the eye. That's this gap right here. The retina's here. This is the sclera, the white part of your eye, and you can see that the detachment has occurred there. So it's just, I'm going to just show you some pictures of just cool stuff that we get to see. Retina fundus camera. That's what we just took that this picture here with. That's that same patient right over here. That's that retinal detachment. Okay, this is actually looking in the eye and seeing it, whereas the scan I just showed you is actually more like an ultrasound of the inside of the eye. But right here, this kind of white wavy area, that's detached. It's actually loosened up and detached from the sclera behind it. So what we get to see and what we get to treat, always interesting. This is a patient with glaucoma. The optic nerve right here is where glaucoma occurs. And that big white spot right in the middle is the cup that's caused by pressure inside the eye is increasing, and it's pushing up against the optic nerve, and it's almost like it's pushing the optic nerve right out the back of the eye by starting with forming this round cup. That's that white area. Normally without glaucoma, that cup would be maybe a third of the size of that round area there, but that's what glaucoma looks like in the back of the eye. Central vein occlusion. You can see all the red spots here. That's just blood that's pooled in the back of the eye. So a central vein occlusion is, you have blood that goes out to the organs in arteries, comes back to the heart in veins. This is a vein where the blood's coming back to the heart, and the vein's been blocked, it's plugged up. And so that blood is trying to go back to the heart, but has no way of getting there, because it's like if you had a water hose and you put a kink in it, the water can't get past that kink. That's kind of what happens in a retinal vein occlusion. So that blood doesn't have anywhere to go, so it just starts spilling out of the vein. It stretches that vein as much as it can, and then that vein just breaks open and the blood just spills out and leaks into the eye. So once again, more technology that allows us to do even neurological testing. The VEP and the ERG is really designed to test the retina and test the optic nerve for glaucoma, for diabetes, for toxicity from medications that might cause problems in the back of the eye. There's just so much that we get to do that starts with the eye. Anterior seg camera takes pictures of the outside of the eye. So like this is a pterygium here. It's just a growth into the clear part of your eye, the cornea. You can see the colored part behind that. That's your iris. And then your iris is actually inside the eye, the blue part of your eye, and it's covered by the cornea, which is a clear tissue that covers the outside of the eye. And sometimes you'll get what's called a pterygium that actually grows onto that clear part of your eye. Obviously, you can't see through something that's this opaque, so that's bad. So typically we have to remove that, either chemically remove it or surgically remove it. There's just a picture of the neovascularization, where the blood vessels, the white part of your eye, are growing into the cornea, and your cornea is a clear tissue, has no blood supply in it. So when you see blood vessels growing into the cornea, that's bad. Okay, that means that your cornea is not getting enough oxygen. The outside of your eye, the cornea gets oxygen from the air, from actual oxygen particles that are floating around the air that land on your eyeball. Your eyeball sucks in that oxygen. When it can't get enough oxygen that way, then it will try to get reserves from the blood vessels that surround the eye. But this is bad. You don't want that to happen. Why is that? Because when you have blood vessels that are growing at this stage of your life, they're really poor quality. So they're going to leak, they're going to bleed, they're not going to do the job. So anyway, when you see things like that, you just know that the cornea is under attack, not getting enough oxygen. There is a metal foreign body right here embedded in the cornea. I remove those probably, once every week or so. Somebody comes in, not wearing their safety goggles. So we have the talk about, I don't mind seeing you. And especially when it's like the third time in a month, I'm like, I don't mind seeing you, but listen, you could do yourself a big favor and just put some safety protection on, some goggles, some safety glasses, whatever. Otherwise, hey, I'm here every week. You come back in and I'll be happy to remove these foreign bodies out of your eye. But some things are preventable. Like I talked about, the electronic medical records definitely have improved the efficiency of not having to look at written patient files. But what's even better about electronic medical records is, for example, the ability to remind patients it's time for an exam. I mean, how many of you get little texts from your doctor saying, hey, you've got an appointment in 2 days or a week or whatever? I mean, that has really made things much, much easier. I laugh because when this first came out, and we started sending our reminders via electronic health records, I remember I was having lunch with my daughter, and she got text, and she picks up her phone, of course, because she's not gonna let that text go no. She says, well, thanks, Dad. So I'd send her my system sent a birthday wish on the birthday. It's just programmed to do that. I'm thinking to myself, I mean, you guys don't know any other way of doing this, but for me, who started out with paper claims and nothing like this, it's just pretty phenomenal that my office is sending text to patients and I don't have to do it. You know, I'm sitting there enjoying lunch with her and she's gonna get text from me. I know you guys think that's no big deal, but for me, it was pretty impressive look at technology. So what kind of products do we provide? Obviously, you know, for those of you who are wearing glasses, you've had an eye exam. Has anybody not had an eye exam before? Okay, so either you got really good eyes if you're not wearing glasses, or you're wearing contacts. For those of you who wear glasses, obviously, you know, I know you've had an eye exam because that's where you got it. But those are some of the products that we use. Contact lenses, obviously, low vision aids. You know, there are patients, there's a small percentage of patients who are what we call physically impaired to where they can't see what you and I are seeing. And so they use what we call low vision aids. For some people, that means they use a computer screen to blow up what you want to read into words that are this big so that you can actually see them, because that's all you can see. You can't see small detail. So we've got low vision aids now where they're just big computer screens that you can read. For some of them, computer screens this big and you're reading one word at a time, but at least you're able to read. Because prior to having that kind of technology, you're just out of luck. You couldn't communicate. You couldn't communicate via you know, reading any kind of information. So as far as practicing optometry, there's lots of different options to practice optometry. You can be in a private practice. What they call a private practice now is basically owning your own building or leasing your own building, and the doctor controls everything in that practice, does all the hiring, the firing, the training, sees the patients, maybe adds a partner. You might have a group practice of doctors who are partners. You can be in a corporate location like I am. I've been practicing in the Walmart Vision Center here now for 31 years. It's a form of private practice because I don't work for Walmart. I rent my space. I don't sell products. That's what I love about it is I didn't go to school for 8 years to sell glasses. I went to school for 8 years to provide services, to do the examinations, to make you see better. But I didn't really go to be a salesperson. So I like the aspect that somebody else does all the selling of the products. In my office, I don't have to worry about it. I have to invest in an inventory of frames and lenses. I don't have to hire people to sell them. I just do the examinations. I do what I was trained to do. That's one way. You could be a franchise owner. Like if any of you have ever been to a Pearl Vision, those are franchises that are typically owned by a doctor, but in partnership with Pearl Vision franchise. You could work with an ophthalmologist. You can partner with an ophthalmologist, but most doctors are actually employed by ophthalmologists. Ophthalmology are surgeons that are eye doctors, which in some states is becoming less and less of a differentiation because, like I said, in some states, optometrists are actually doing the surgical and laser procedures, but there's always going to be ophthalmologists who are specialists in certain surgeries of the eye that optometry probably won't be performing anytime soon. Optometry, in my mind, is really more of the primary care physician for eyes. Okay, if you go to a primary care physician until you need a specialist, and then the primary care physician is going to refer you out to a specialist to have whatever needs to be done. That's really where I think optometry and ophthalmology work best together. The optometrist, the primary care physician, sees most everything, but when a surgical procedure is done that we can't perform, we'll send the patient to the right specialist. You can also practice in a military or a veterans hospital. You can also be an instructor in one of the optometry schools or medical schools. I have a lot of colleagues who actually are professors in the medical schools, teaching ophthalmologists aspects of eye care that optometry really are specialized in. And then you could also be an employee of a corporation, whether it be, in certain states, you could be an employee of Walmart, or an employee of Lens Crafters. Or in certain states like California, they have HMOs, where the HMO owns the hospital, employs all the doctors, and so the doctors are all employees, not just optometrists, but all doctors are employees of the corporation that owns the whole healthcare facility. Any questions about what optometry does? Because we're going to move here into the application process. Okay, and let me just ask, what year are y'all in?
Sophomore.
Sophomore? Freshman? Who's a junior? Who's a senior? Okay, all right. So the application process, it takes a little bit of time. If you are going to apply to go to optometry school in the fall of 2024, you probably need to get the application process going right now. So you're about a year out from when you would want to start your education is when you start to get all the paperwork together and start the process of getting your application in. One part of that is taking an OAT. Medical school has the MCAT, optometry school has the OAT. And so it's a standardized test that all students will take, and you'll need that and you're going to have to do reasonably well on it, at least median or medium or above to get into optometry school today. And then of course you finish with the rest of the application process. And some of the schools require you to shadow. So and they'll also require you to have referrals as part of the application from eye doctors. Now, let me make a recommendation to you for this. Is if you're going to look for a doctor to make a referral for you for your application, you better get to know them first, okay? Because I do get requests from students from this class to fill out a referral for them. I have no problem doing that, but realize that the questions they ask are things like, how well do you know this person? And how much experience do you have, and how good are they at this and this and this? Those are hard questions to answer if I don't know who you are, okay? So if you're going to ask somebody, whether it be me or somebody else, start the relationship now. Start building the relationship, like with your own eye doctor, okay? Somebody that you know that is an optometrist. I would start that process now and get to know them, shadow them if they'll let you shadow them, so that when you do ask them to fill out this application, part of the application for you, that they can give you a good recommendation. Because I'm going to answer it honestly, and if I don't know you well enough to answer the questions, I'm going to answer that honestly. So that's not going to be your best recommendation from somebody that you've only met once or whatever. So just keep that in mind when you start the process. Don't wait until you are ready to submit your application to start building a relationship. Start it a year out. Pick some doctors, whether it's optometry or you go into another healthcare profession. Start getting to know somebody in those professions now, at least a year out, so that when you do ask them for that referral, that they can base it on something that will actually be a good referral for you. So the OAT test, I'm not going to spend a lot of time here, but it is a test you got to take. It's online. You can take it an unlimited number of times. You'll take it the first time, you'll see where your score is at. And by that time, you should have a good idea of what the median score for the school you want to go to is. And you just keep taking it until your score is above that number, so that you're going to be a better candidate for the school. So if you take it more than once, you do have to wait 90 days between tests, but you can take it multiple times. As far as what do you have to do to get into optometry school? that starts now. You need to start taking the right classes. Okay, and this is the pre-optometry requirements for ICO, and I'll show you the CCO here in just a moment, because there's two schools here in Illinois. One of them is downtown Chicago and one of them is in the suburbs. There's also a school in Umsel. There's a school in Indiana, the University of Indiana, Ohio State, University of Alabama, University of Houston. There's a school in Memphis. That's where I went to optometry school, was in Memphis. There's one in Portland, Oregon. There's one in Philadelphia, New York City, Tahlequah, Oklahoma. I think there's like 28 schools now, 29 schools. There's 3 in Texas, 3 in California. And they're adding more schools every couple of years, which is good because right now there's this shortage of optometrists. I'll just tell you right now, you graduate from optometry school today and you can kind of pick where you want to go because everybody is looking for help. I have an office in Springfield that I would love to have a full-time doctor in today. I had one in Quincy that I would have filled if I could. There's all kinds of opportunities in the healthcare profession, but especially with optometry. You'll have no problems finding a job, finding a location, and doesn't mean you have to stay in Illinois. You can pretty much go to any of the 50 states. You just have to be able to get a license in whatever state you practice. But that's not that difficult to do for most states. There's some states that are more difficult for all healthcare professions. For example, can you take a guess at when's probably the most difficult to get a license in? If you want to venture a guess, what state do you think is the hardest to get into? Take a guess. California is hard, but it's not the hardest. It's Florida. Why do you think it's Florida? It's weather's beautiful. It's nice all year round. And that's where we all want to end up, is in Florida. That's where we want to retire. So it is difficult to get a license in Florida. But most of the other states, it's not difficult at all. In fact, a lot of states don't even have a test you have to pass. You just apply once you get your license, or once you graduate. Now, having said that, just because there's not a test for the state, there are 3 boards that you have to pass in optometry school to be able to get your degree, to be able to get that degree that'll allow you to get your license. So it really doesn't make sense for the states to have a test for you to take when, quite honestly, you've already had to take 3 tests and pass them, and they're intensive, they're hard, they're difficult. Not everybody passes them. To add a 4th test on top of the 3 you already have to take does seem a little punitive to me. But every state is a little different. And some states want to limit how many doctors they have within the state. And other states, they don't care. Bring it on. However many of you want to come practice in Illinois, you sure can, because Illinois, all you have to do is have a license or a degree, optometry degree, and you can apply for a license. And that's most of the states here in the Midwest. That's the way it's set up. Anyway, there's the classes. There's more classes that you got to take. So you got to take all your science classes, and then you need to take some of the humanities courses. Okay. So what do you think you should get your degree in? Well, first of all, how many of you are biology majors? How many of you are chemistry majors? Physics majors? Okay. What else do we have here? And so one biology hand go up. What are you getting your degree in?
Medical science.
Medical sciences. How about you?
Also medical sciences.
Okay.
Which is an option of biology.
Yes.
Okay. Okay. So medical sciences is basically just a broad, is going to get you all of, do you have to take most of these classes to get there? Okay. Well, and there's nothing wrong with that. Okay. Now go ahead and ask me.
What did you major in?
What did I major in? I got my degree in Latin. Okay, I love that book right there. He gave me that. What the heck are you talking about? So here's what I did when I went to the University of Iowa, and I'll tell you my story. How did I decide to become an optometrist? I know you guys are just dying to hear this, but here's how it happened. Because everybody, you're all going to have your story. Okay, so here's how it worked out for me. It started when I was 16 years old. I was in driveway washing my car, and I grew up in Iowa, a little town of Iowa. And in Iowa, you have two choices. Typically, you're going to the University of Iowa or you're going to Iowa State. If you're going to be a medical doctor, you're going to the University of Iowa. If you're going to be a veterinarian, you're going to Iowa State. I was going to be one of those two. I wasn't sure which. I was listening to the football game, Iowa versus Iowa State. And Iowa just pummeled Iowa State that day. Just kicked them up and down the field. And I just decided, you know what? I cannot go to a school that had a lousy football team. So that day I decided, okay, I'm going to be a medical doctor instead of a veterinarian. Up to that point, it could have gone either way. So how do I decide to become an optometrist? Okay, I went to University of Iowa, and I went to the medical school dean. I said, so listen, what do I get my degree in? What I want to, at that time, I wanted to be a medical doctor. I said, what do I get my degree in? What do you recommend? He said, we're gonna teach you all the science that you need when you get into medical school. You're gonna have to take a certain number of science classes, like I just showed you, okay? He said, but what we can't teach you to do is have great chairside or bedside manner. So he said, go get a degree in the humanities. Pick whatever one you want, get a degree in the humanities, okay? Because that's the aspect of medicine we can't teach you. We can't teach you to be a human being. We're going to teach you the science aspect of it, and you're going to have to take all the science classes just to get in. So go get a humanities degree. So I loved my Latin class. The first year I took Latin, I loved the professor, so I stuck with it, knowing that it really didn't matter. I could get my degree in anything I wanted to as long as I took all the science classes, which I did. Got into my third year of school at the University of Iowa, and made up my mind I was going to be an obstetrician. I wanted to deliver babies. That's what I decided I wanted to do. And I was reading an article in the Des Moines Register, and it said that obstetricians in the state of Iowa had to pay $100,000 a year for liability insurance. Okay, what is that? That's what you have to pay so that if you get sued by a patient for doing something wrong, that you don't go bankrupt for making one mistake. So you have to have liability insurance. Whatever healthcare profession you go to, you got to have liability insurance. Okay, so this was back in 35 years ago, and you're going to spend your first $100,000 that you earn in a year just on liability insurance, and I'm like, that's crazy. So I'm like, that's not going to work for me. I'm going to do something different. 2 weeks later, I was sitting in my optometrist chair. He happened to be a family friend of mine, and I was getting my eye exam. And he asked me, so what are you doing for when you graduate? I said, well, I don't know. I was going to be an obstetrician. That's off the plate. So, well, he talked me into applying for optometry school, and obviously that's what I did, and I got accepted and I got in. So there's my story. Like I said, every one of you will have your story. How did you end up doing what you're doing? Okay. That's mine for whatever it's worth. I have no regrets. I absolutely love what I do day in and day out. I have patients now. I'm getting to the probably the last third of my practice years, and patients are asking me, how long are you going to be here? And because they're measuring me up. Do I want to keep coming back to you, or do I want to find somebody who's younger that's going to be taking care of me when I'm older? My response at this point is I'm never going to retire. I just absolutely love what I do every day, and have no plans. I have no exit plan in place right now. I'm 58 years old. I plan on practicing into probably my mid-70s. And quite honestly, that is typical for my profession. A lot of us will practice into our 70s. It's not a physically demanding job. You know, you spend half your day sitting down. You spend a lot of your day typing, okay? So far, it doesn't really sound like a medical job, does it? You know, you're typing and you're sitting down. So it's not a physically exhausting job. So that's why we can do this forever. The other thing is we're not doing lots of surgical procedures. So surgeons, they don't practice into their 70s. Why? Because you lose that ability to perform surgical procedures. You know, do you really want to go and have a 70-year-old surgeon doing your cataracts? I mean, I personally am not going to. I'm going to pick somebody who's a little more younger, nimble, you know, and when I say younger, folks, younger by my standards, not your standards. Young by my standards is, you know, mid-50s is young. So I get it. You're already thinking, well, that's not young. Well, yes, it is. When you get to be this age, mid-50s is still young, okay? But I'm not going to a surgeon when they're 70. So surgeons have a much shorter window to practice. Whereas other doctors like eye doctors, we can do what we do for a long, long time. Like I said, it's just not a difficult, not a physically difficult job to do. So as far as things to do right now, you know, shadow, observe, learn about optometry, or learn about whatever healthcare profession you're looking at. But if you're thinking about being an optometrist, and one of you in this room here is going to be an optometrist, I guarantee that, then learn as much as you can about it, okay? If you wear glasses or contacts, you get your eyes examined every year, you're learning about it because you're going in and experiencing exactly what we do day in and day out. But you're experiencing the healthy aspect of what we do, okay? Young people like yourself come in, you know, have healthy eyes. When I say healthy eyes, you don't have glaucoma, cataracts, macular degeneration. You just need correction to see better. Well, guess what? That's a sick eye is not an eye that's wearing glasses or contacts, okay? That is your genetics at work. And what I will tell you is what I tell every child I have or every kid I have in my chair is, you inherit your eyes, you can't pick your parents. You're going to get what you get, and there's not much you can do about it, okay? Unless, and here's where technology comes into play, unless you are born to be nearsighted, okay? So if you have parents that can't see far away, who are wearing their glasses since they were little, in order to be able to see across the room, watch TV, drive a car, things like that. Well, here's where technology is improving again, is that now we have therapy for myopia that will help limit how nearsighted you're going to be. Now, unfortunately, folks, if you are in college and you're nearsighted, you're already about as nearsighted as you're going to be. So unfortunately for you, there's no fixing, okay? Where myopia therapy comes into play is when you are still growing, like you are, you know, between the ages of 5 and 15. If we catch you at younger ages, there is now therapies we can do to try to limit how nearsighted you become. That has really grown in the last, I would say, 10 years. Because the first 20 years I practiced, you know, we would prescribe glasses, we prescribe contacts, and we would just watch you get more and more and more nearsighted. But here's what I can tell you. Do you know what causes that nearsightedness? Why do all of a sudden in the last 20 years do we have this huge influx of nearsighted individuals? Nearsighted mean you can't see far away. Any guesses? Any ideas? Any thoughts on what's causing this huge increase in nearsightedness? Yeah, it's any kind of screen that you use. Fortunately, I know your college students, you are so busy studying and doing your homework and everything like that, you don't have time to look at your cell phone. Unless everything you do is on your cell phone, and maybe that's the case today. But I will tell you, if you were a 10-year-old sitting in my chair today and you were nearsighted, I would tell you to put your cell phone down. Because that's what's going to cause you to get more and more nearsighted. I would tell you, go outside and play. Because if you're outside playing, you're not looking at a screen. Okay. Here's what's inevitable about it is they don't listen to me. They're gonna go look at their cell phone for hours on end. Okay. So I've done my job. I've recommended that they not do that. And now my job is to treat them and give them the best vision I can. This is what you call job security, folks. Okay, cell phones for an eye doctor are the reason why there's a shortage of eye doctors today, is because there's not enough of us to treat all the eye problems that are out there, especially that are caused by looking at screens. Okay, I now treat kids for dry eyes because of how much time they look at screens. Okay, dry eye used to be a over 60 disease. Now it's a any age disease, because of the world we live in today. It's evolving, it's changing, and it's going to make every eye doctor that much busier. So you never have to worry about today in the society we live ever not having a job or not having enough to do. Because most eye doctors I know are booked out weeks or months in advance because there's such there's just not enough of us.
You don't mind me asking a question?
Sure.
What did you say you could do for therapy though? Because other than putting the cell phone away, like lab.
Oh, so the therapies include drops. They actually have drops now. They have contact lenses and glass spectacle prescriptions for the therapy. There's lots of different things we're doing. Basically, we're taking the up close strain off of the eyes with correction, either glasses, contacts, or drops. We'll treat the myopia. The downside to it is it's not covered by insurance, so it's all out-of-pocket expenses at this point in time. I think that'll change at some point in the future because it's a disease. I mean, the myopia, that increased nearsightedness, it's a disease. It's to a degree self-induced and to a degree genetically driven, but it's still a disease nevertheless. So keep in mind, different schools have different requirements. So what I was showing you today was the schools in Illinois. But you can reach out to the different schools, and quite honestly, I mean, this is your chance to when you apply to any professional school, it's your opportunity to see the world. You know, just because you grew up in Illinois doesn't mean you have to stay in Illinois. There's advantages to staying close to home, though, for sure. But like I grew up in northern Iowa, I ended up in optometry school in Memphis because there were no optometry schools in Iowa at the time. And you know, I bypassed the Chicago school at the time. There was only one school in Chicago, and I looked at it. I showed it to my dad on a map, and my dad was a business person, did a lot of business in Chicago. I showed him where it was at. He saw the location. He said, well, that's one school you can't go to. I said, why? He said, because that is one of the worst areas of Chicago that you could go to. So no, you're not going. Now today, I've been there. I've taken education classes there. It's changed completely. So the schools in Chicago right now are in nice areas, but 30 years ago, the school in Chicago was not. So that's one of the reasons why I just bypassed it. And also, to be honest with you, I was looking for warm weather. I mean, I grew up in northern Iowa, and so I was looking at southern schools. If I was going to move away, because at that point in time I was going to have to go somewhere out of state. I'm like, I've grown up in northern Iowa my whole life. I'm going to go I'm gonna go experience a little warmer weather. So I went to Memphis for that exact reason. So here's some of the expectations that you might look at for, and this is the entering class, I think, for if it wasn't the this year, it was last year's, but I think it was this year's class, I think is what I was able to find. But you can see where we're at. You know, you got to get good grades. You know, the average GPA is 3.48. You know, that means there's some 4.0s in there, and that means there's some 3.0s in there. So, you know, you just want your GPA probably to be above 3.0 to get into optometry school. The OAT, I think the median on the OAT is like 300. I think you probably want to get 310 if you or above if you can. You can see the number of students that apply. Approximately 600 students apply, approximately 110 get in. So it's about 1 out of 6. The schools here in Illinois, actually, the majority of the students that go to Illinois schools are from out of state for whatever reason. Could be because of the cost. I know that the 2 schools here in Illinois are probably more expensive than some of the others. But optometry school is not cheap. I'm going to guess that the average right now is in the, I'm going to guess probably in the 50 to 60,000 range per year. And when I went to school 31 years ago, when I graduated, I was paying $26,000 a year for tuition. So it's never been cheap. You know, so I came out of optometry school with like $110,000 in debt, which to me at the time seemed like a lot, but a lot of my colleagues in school were coming out with $200,000 in debt. The reason mine was so low is because I got married the week before I went to optometry school, and so I had a wife who was you know, had a really good job, and she paid for our living expenses, and I had to borrow for tuition. But my students, my colleagues that were students without spouses, I mean, they had to borrow everything, living expenses and school expenses. Now, here's the good news. When I applied SCO, I remember as part of the interview process, they said, you know, that the number of students that pay back their student debt was like pushing 100%. Which at the time I'm thinking, well, why are you even telling me this? Who cares? I don't care about student debt. I'm not even there yet. Afterwards, I realized why that was an important comment, because once you get out and you realize how much you owe, it's good to know that you're going to be able to afford to pay it back. And you will, because optometrists typically make a pretty good salary. And then the last one here is the ratio. Now, when I went to optometry school, it was about 50-50 males and females. And now all of the healthcare professions really lean towards a much higher percentage of females than males that go to optometry school. And I don't, you know, I don't know why that is, but it is the case. And it's not just optometry school, it's medical school, it's dental school, it's all of the healthcare professionals are dominated by women, and you know, which is, you know, perfectly fine. I don't, as far as optometry goes, there is no reason why males and females can do the same. Okay. You know, there are probably certain professions, maybe like, you know, being an orthopedic surgeon probably just takes a lot of muscle. I mean, orthopedic surgeons are basically just carpenters of the body, do a lot of drilling and a lot of sawing, and a lot of, you know, and probably take more physical stamina to do it. That would be the only profession I can think of really where there'd be a difference. And I'm sure there's lots of orthopedic female surgeons out there. But as far as optometry goes, I don't see any issues. This is just a copy of if you just Google the optometry schools, they have, you know, what's the statistics on the graduates of 2026. So this would have been the incoming class for 2022. I think I've got my numbers right there. But you can, I just copied that off. And there's the profile of the Chicago College of Optometry. That one is in one of the suburbs, and you can see the GPA is a little lower. The OAT is a little lower. This is a newer school. This school's only been in place for I'm gonna say maybe 6 years now. I'm gonna guess, but I mean, they're now credentialed, and there's no question you can go and get your degree there and be an OD just like anybody graduating from any of the other schools. Smaller class size, really state of the art, very up to date. It's got a really nice campus for optometry, but you share a lot of what you do with other healthcare professionals because they've got other healthcare professionals that are going to school there as well. Whereas ICO in downtown Chicago is strictly optometry, this school has others. So you might be sitting in class with other students that are going to maybe physical therapy, or I don't know if they have a medical school there or dental school, whatever, but you'll be sharing classrooms with other students for at least the first couple of years. So here's my best advice to you as far as choosing. How much time do we have? Are we done?
Oh, yeah, we're really at the end of it.
Okay, all right, then I'll finish up here. How to choose a career. I mean, you got to decide, what do you want to do the rest of your life? And you're what, 20 something? You got to make these decisions. So how are you going to make that decision? Because that's kind of important. I'm lucky. I made the decision, and 31 years later, I'm absolutely convinced I made the right choice. Okay. But I'm sure there are some of my colleagues out there that 31 years later are thinking, what in the heck did I do? So how do you make such an important decision for the rest of your life? Okay. Couple things, choose your lifestyle. This is the best advice I can give you. Is how do you want to live your life? What kind of lifestyle do you want to have going forward? Do you want to work Friday nights every week? Then you know what? Be an emergency room physician, because that's the best part. Friday, Saturday nights, that's when you're going to see the most interesting patients. But you're going to give up every Friday and Saturday night for the rest of your life. Do you not want to work weekends? Do you just want to work 9 to 5, Monday through Friday? Well, then I would suggest be an optometrist, or be a dermatologist, or pick something that doesn't have a lot of emergencies. I get called out at night from home probably once every 3 years. So I've been called out for emergencies probably 10 times in my career. Okay, so as an optometrist, lifestyle is I'm working pretty much 9 to 5 or 9 to 6, Monday through Friday. I've worked a lot of Saturdays over my career. Now I don't work very many Saturdays at all. So you got to choose, how do you want to live your life? To me, having a family, very important. I want to be home with my family at night. I want to be able to spend time with my kids. They're all grown now. So now I'm spending time with my grandkids. So those are things you want to look at as far as what profession you're going to go into. Think about what hours does that professional work, and are those the hours that you want to work? The eye surgeon here in Macomb, small town, one eye surgeon, one ophthalmology who's a surgeon. Do you know how many days a week she's on call? 365. She's on call every single day of her life, unless she's out of town. And if she's out of town, then she has to find somebody to cover her from out of town, since there's only one surgeon here in town. So she's got a lot of responsibility to be on call. So what does that mean on Saturday nights? On Saturday nights, can she go home and kick back a couple beers, glass of wine? No. I mean, if you're going to do that, you have to take yourself off of call. Okay. So as an optometrist, working for myself, I can take myself off call. I just don't answer the phone, and the phone will take you and tell you to call the emergency room, and that's where you'll go. Okay. So those are the kind of things you want to look at when you're choosing, what am I going to do the rest of my life? And that, I think, is really, I'll stop there. One last thing. If you were going to ask me what to get the degree in, Like I said earlier, I got mine in humanities. The one thing I would tell you is take some business classes along the way. Take an accounting class. Because folks, you're gonna have to have an accountant when you get out into the real world. You might as well know a little bit about it before you get there. And no, it's not necessarily gonna make you a better doctor, but it's gonna make you a better business owner. And every doctor is a business owner, folks. I know you think all we do is take care of patients, but we have to run a business in order to be able to take care of our patients. That's all I got. So any questions? Yeah, there's my email. So you're welcome to fire questions away. I can also, that's probably the best way to get a hold of me.
If you don't have to rush off to a class and want to ask something.
Yep, sure. Happy to answer any questions.
This is Dr. Bots for a minute.
I've got it.
Sure.
What can we do to like keep our eyes healthy? Is there stuff you would avoid, stuff that you would recommend?
So diet, things that we've learned that are good for the eye are say green leafy vegetables. Like spinach, kale, broccoli, provides lutein. We know lutein is good for the eye, omega-3s. So you used to get omega-3 out of fish oil, or you can take supplements, or you can eat salmon, tuna, halibut, cold ocean water fish. So there's definitely things you can do in your diet that will keep your eyes a little healthier. Limit the screen time because you're going to dry out your eyes if you spend too much time looking at up close work. Now, obviously, in school and college, you don't get to limit it. You got to do exactly what you're told to do. But once you get out, then you can limit your screen time.
So if you have to look at a screen for a long time, is there?
If
I've
you
seen
have to,
things like-
your eyes are gonna dry out, so you can use artificial tears, lubrication drops to keep them wet. Omega-3 will make a better tear. There's lots of different treatments for dry eye. So if you go to the eye doctor and they diagnose you with dry eyes, they're gonna give you a therapy treatment to do. I would follow it, okay? At your age, that's probably really the biggest issue. Unless you have a really, really strong myopic prescription. And you're not wearing glasses, but you could possibly be wearing contacts, I don't know.
I was prescribed glasses, I just.
You don't want, so you've got good eyes. Yeah, just the biggest issues you have right now is gonna be eye dryness. That's really the issue, and then just, overall health, just eat a balanced diet. But make sure you're getting a little bit of green leafy vegetable in there.
So what was the vitamin you mentioned?
So lutein is, and I'm not necessarily gonna tell you to go out and take a
No,
lutein
yeah, I'm
supplement,
just curious.
because you could just get it through a healthy diet. And the best form of lutein comes in spinach. Spinach, kale, and broccoli are your best bets for lutein. Vitamin A, they used to say eat your carrots. And to a degree, that's right. But you don't want to overdo. You don't want to overdo the vitamin A. You want the right amount, not too much. But obviously exercise and if you spend enough time outside, you're getting away from the screens. That's going to help. So live a healthy life.
Gotcha. Good to know.
All right.
So when kids are looking at this, basically is this changing their lens shape over time, it's adapting to that kind of isn't it?
As far as the myopic therapy, what they're really trying to do is take the stress off of your accommodative system that allows you to focus on things up close. They're really trying to make sure you're not over accommodating, over focusing any more than you have to. Because what we have found is that actually lengthens your eyeball. When you're over accommodating on things.
So that eyeball, or I was thinking about the lens.
The eyeball is actually changing in size, length.
I see, okay. The lens doesn't change, so.
The lens is going to get bigger every year. It grows layers just like an onion your whole life. And that's why eventually, we get cataracts and we lose that ability to be up close. We have to wear reading glasses. is because that lens adds layers year after year after year, but the space that it sits in doesn't get bigger. The rest of your eyeball doesn't get bigger, your lens does. And that eyeball, that lens, in order to be able to focus on things up close, it does this. To focus on things up close, it gets fat in the middle. And to focus on things far away, it gets thin in the middle. And if that lens is getting bigger and bigger and fills up the space, it can't get fatter in the middle. So you lose that ability to focus up close. And it hits us all in our mid-40s.
Well,
So.
we were just talking about eyesight at animal phys yesterday, so. We talked about how the photoreceptor cells work and it works a lot differently than you'd expect, because I guess sunlight's hitting it. It's reducing the amount of glutamate that's being released because it closes these sodium channels. And things like that. But,
I'll just take your word on that.
that's wonder. Interesting,
But I will say, what is interesting though, now talking to you makes me think of it. I just went through the training for this new low light therapy.
Yeah.
And what's causing the inflammation is the ATP in mitochondria that is either stimulated and the red light actually affects the mitochondria at the cellular level, and that's where inflammation is reduced.
oh, interesting.
You know, and I'll be honest with you, the last time I thought about mitochondria is when I was in college. But as I was sitting through this class with him, and he's like, trust me, I never thought I'd be talking about, because he was an eye doctor and he was using this instrument. He said, I never thought I'd be talking about ATP again.
Yeah.
And what brown fat and you know, all of that cycle that I don't remember what the cycle's called anymore, but here we are back to it. So, you know, biology, it's not going away.
I mean, we're actually about to go do sutures now, practice. For animal phys, and we're gonna. And I'm not very good at that, but I think you're pretty good at it. So maybe you can help me. He does the EMS also. He's gonna try to be, unless you change your mind, he's talking about medical school. He's actually a grad student right now, for his master's. Hopefully.
And I can make it end.
Well, there you go.
Yeah, so. Yeah, he's
It's
good.
good for you.
Thanks.
Well, if there's anything I can do for you, let me know.
Yeah, well, I'd like to have my daughter come over and start shouting. She's in high school right now, but she's gonna finish up soon. She's a really good student.
Well, good.
Yeah.
Well, she'll have lots of options then.